Welcome, everyone. We are excited to have you here tonight. We still see a few people trickling in, so we'll go ahead and kind of get started and get going. All right. Just watching those numbers kind of slow down. All right. Well, welcome everyone. It's a pleasure to have you all here joining us again for our November provider information session. As you all know, we've transitioned to holding these every 2 months. So this is our last one for the year, but we will see you back in January. Before we get started with the content, we want to make sure that anyone who needs interpretation is able to access it. If you need interpretation, please make sure to click the little globe icon at the bottom of your screen. If you're on your phone, you should see it there, as well as if you're on a computer, you should see that little icon, and then you can select your language. We have several languages available today. We have Russian, Cantonese, Vietnamese, and Spanish, and we've also have pinned ASL interpreting. If you are joining us on Facebook, please click the link there to join us on Zoom so that you have access to the ASL interpreter if that is something that you need tonight. So, si necesita interpretación a español, por favor, presione el icono que está en la parte inferior de su pantalla para que pueda seleccionar el idioma de español y así escuchar la información de esta tarde en su idioma. Pause and give people a second. All right, and for today's agenda, we have two main topics, which include our COVID-19 check-in with OHA, Oregon Health Authority. Secondly, we'll have information for ERDC expanded eligibility with some of our partners. And lastly, we'll share several agency and program updates. We were kind of adding a few there until late today, so just excited to have information to share out with all of you. Again, we will have some time for questions after each of these topics. We have the question and answer icon on your screen, which you're able to use and just ask any questions on there, and that helps us keep track on them and make sure that we get to as many as we possibly can. If you're on Facebook, please ask any questions in the comment boxes, and we have staff keeping an eye on those to make sure that we can also address them. So Facebook and Zoom questions are both being monitored. With that, we will go ahead and transition over to our first topic. Before I do just want to remind if anyone has to hop off early or there's information that you'd like to listen to again, just a reminder that we will have the recording available on Facebook. And then tomorrow you should find the recording available on our website. We have under the icon there, provider information sessions now. So you'll be able to find all the information there. And Allison has just put that link in the chat here for our Zoom participants to be able to access previous recordings as well and the slide decks. All right, with that, we'll go ahead and jump over to our first topic, which is COVID-19 updates for childcare providers. And we have Needy and Kristen here today to share some information. I will kindly go ahead and hand it off to you, Needy and Kristen, to introduce yourself and give us all the highlights and updates.
Wonderful. Thank you, Karina. My name is Needy. I am the community epidemiologist from the DSAT division, or Acute and Communicable Disease and Prevention Department now. We just switched and we just moved to a new department, but our role still remains the same. I am also a board-certified infection preventionist. By that, it means that I perform infection prevention and control process for a lot of non-healthcare congregate settings, which include houseless populations or shelters, schools, ELD, and childcare. I've been working with a lot of your providers here. It's been some time since I saw you, which is so good. Just a quick visual description for OHA accessibility policies. We always give a description. And so I am I am a brown female. I'm from South Asia, India to be specific. I'm wearing a beige top, and I have and earrings and my hair is open today. So, sorry.
Sorry to interrupt you. We're hearing a little bit of like an echo in the background. Not sure if it's some feedback from your computer or elsewhere. I was trying to check.
Will it help if I go off camera maybe?
It sounds more like an echo.
Somebody said you might need to keep your body still. Oh, okay.
I think we can do better now. Yeah.
Okay, I will keep my body still. I am a very animated person when I talk. Okay, we can move to the next slide. Can you guys still hear me clearly?
I think you're coming through a little bit better. Yes. And I'll let you know again if it gets odd again. Yeah. Thank you.
No worries. Before any conversations and just to kind of give us an understanding of where we're at and why we're doing what we're still doing, I think it is important to know what we've gone through, and that means getting some data around what COVID-19 is overall in the US, especially. So, as you all know, we've had over 2 million cases, around 20,000 hospitalizations, and over 200 deaths. Specifically, if you think about the age group, it would be 6 months to 4 years of age. We know that COVID-19 can cause severe disease, and including children without underlying medical conditions. So something that we are very aware of, and we are working towards managing these conditions, or at least controlling them. 200 deaths, specifically if you think about the age group, it would be 6 months to 4 years of age. Sorry, I think I can. Let me just go off camera because I think I'm hearing myself again. Okay, so I need to wear a headset. I just got it. Can you guys hear me okay now? I really apologize for the issues. I'm not sure what's happening. Okay, so future surges, as we know, with the variants, different variants that are coming up, it will continue to impact children, and we have enough data to show why unvaccinated children still remain at higher risk. And reinfection with COVID-19 is increasingly common, as we've experienced throughout the pandemic. Next slide, please. We wanted to put these updates. I know that you guys are already aware of this, but since we haven't met you in 6 months, I think last meeting was in July. The updates to COVID-19 guidance include isolation for 5 days for those who've tested positive or who have 2 primary symptoms after their exposure to COVID-19. Individuals 2 years and older are definitely recommended to wear a mask for 5 additional days, so which is day 6 through day 10 to be specific, after the end of their 5-day isolation period. And an individual should continue isolation if symptoms are not improving by day 5. And Kristen will talk more about it as she walks you through the isolation chart that she's so beautifully worked very, very hard on, which will be very helpful for you to understand the progression. Next slide, please. I did want to bring this up and talk about this for a minute. Masking, as you know, we are talking about source control here. So in any respiratory illness or disease, we need to understand the importance of masking, which is again source control. Everyone who's 2 years and older should wear a well-fitted mask, which is very important again to be underlined. A well-fitted mask for 5 days following their isolation period. During periods of high COVID-19 community transmission, universal masking is strongly recommended. And I wanted to show you this graph because we, as a state, no longer have Oregon-specific community risk transmission levels from OHA, but CDC will give you this graph specifically for Oregon, and will tell you about the risk transmission levels. And I've highlighted the colors that they usually use. Green is low risk, yellow is medium, and orange is high. So it's always good to see that we don't have any in orange. But again, a quick reminder around masking, specifically if you're in a high risk community transmission level. Next slide, please. And for those who are, unvaccinated or immune compromised, or at increased risk, if I can, if I need to cover all the points, we are also recommending masking, even when it is a medium COVID-19 community risk transmission, because as we know, even at lower risk, individuals who are themselves at high risk have higher chances of contracting the infection. So we do recommend masking, especially when you're symptomatic and are still in medium community risk transmission. And remembering that vaccination is also one of the important protective factors. And if you don't have that, then we would like to continue masking. Next slide, please. And now I do want to end my my portion with good news. So, that bivalent COVID-19 booster is now available for everyone 5 years and over. And when we talk about the updated bivalent booster, it is called so because it gives you protection against Omicron and the latest variant, the last variant before Omicron as well. We all know that it is a best protection as we enter into another season of other respiratory viruses like RSV, flu, and other things that we need to be careful about. So as we enter our flu season or respiratory virus illness season, if we can add shots to your appointment, it makes the work easy. You go to the same place, you get your COVID shot as well as your flu shot. And I have given you a link over here, which was a blog post, and I think it is a very wonderfully written blog post, which I think it would be helpful for you all as providers to read and share if needed, to kind of talk about what these bivalent boosters do and how they are very helpful. Next slide, please. I did just want to add the links again. I know we discussed this last time too. These links are, they keep on updating these links with new information. So please keep this with you just in case you get asked about where do I get a shot, or why do we need it and how is it helpful, and things like that. So I have added links here, and please feel free to access those links and get in all the information that you would need that you find helpful for vaccines specifically. Next slide, please. Okay, I'm going to hand it off to Kristen, who is our educational epidemiologist, to walk you through Oregon-specific COVID updates and the isolation algorithm. Kristen?
Hi, everyone. Can you hear me okay? Hopefully.
I can hear you, Kristen, yes.
Great. Okay, so my name is Kristen Hollywood. My pronouns are she, her, hers. I'm also an epidemiologist with NETI at the Oregon Health Authority, and I focus primarily in the K-12 setting, but I've also been doing more and more work in the ELD setting recently. And so for this slide, we're looking at pediatric COVID-19 case rates by week over the past few months. And so you can see the different shades of blue represent the different age groups. And most recently, the 0 to 4 group had reported the highest case rates. And I was actually able to look at this data more recently, so on November 1st, and it's still holding true with the 0 to 4 age group having the highest case rates. Next slide, please. Okay, and so for this slide, we looked at a few different data points for the early learning setting, and we looked specifically at the last 2 months, so from September 1st through November 1st. And the first point we looked at was the total number of COVID-19 cases, meaning children under 5 who had tested positive for COVID or had an exposure with 2 primary symptoms. And that number was 1,129. The next point we looked at was the total number of early learning. Oh, yeah, sorry, same slide. was the early learning outbreaks, which was 12. And OHA has recently changed this definition for the early learning setting. So it's no longer defined as 2 or more cases, but it's now based on reaching an absenteeism threshold. And we'll talk about that more on the next slide. The next point was the average number of cases. Oh, sorry, still that slide. The average number of cases linked. It's okay. The average number of cases linked to these outbreaks was 6.4. So rather larger than what we've previously reported, but that's again because of our new outbreak thresholds. And the last 2 points we pulled were the number of COVID hospitalizations associated with children under 5, which was 29. And the number of COVID deaths associated with children under 5, which was 0. And again, this data is just for the past 2 months. Next slide, please. Great. And so this slide just goes over in more detail those absenteeism reporting thresholds. And so previously you were reporting individual cases to your LPHA. And now you would just need to report unusually high levels of absenteeism associated with respiratory illness. And those thresholds are at the school facility level. So any bigger center-based childcare program, it would be greater than or equal to 30% absent, with at least 10 students or children absent. And then at the cohort level, so that would be like a smaller home-based childcare program or a classroom, it would be greater than or equal to 20% absent, with at least 3 students absent. And again, this is these thresholds are associated with respiratory disease. So for example, if you had 3 students that were absent right before winter break, but there was no respiratory illness associated, you would not want to contact your LPHA for that. Next slide, please. Okay, and so this just the first bullet gives you your LPHA contact information. So if you don't know who to contact, if you haven't contacted them before, you can just click on this link and it will provide their phone number and their email address by county. And the next bullet point just kind of goes over once you contact your LPHA, they'll start an outbreak investigation. They won't actually open a COVID-19 outbreak until they have one confirmed or presumptive case of COVID-19. So for example, if you have 5 students out with respiratory illness and none of them test positive for COVID, that would still stay a respiratory outbreak. And say, for example, 2 of them test positive for influenza, it would then become a flu outbreak. Next slide, please. Okay, and so this flow chart is something that we developed a few months ago for ELD. It also exists for K-12, and it basically just walks you through exclusion and isolation for different symptoms. And we did make a few, I won't go through the whole thing because I know that's a lot, but we did make a few updates recently to this. One being is we made it more applicable to all communicable disease and not just COVID specific. So one thing we added was at the bottom of the left-hand side, we added other symptoms. So we included all of the symptoms that are in the communicable disease guidelines. And we also added the has symptoms yellow bubble. And then below it, for the green bubbles, we edited those as well. So to make it more inclusive of all communicable disease, we changed it to other symptoms, and then to follow the disease-specific return to childcare guidelines. So you can click on that link and then you can find out how long your child or staff member would need to be excluded for. And so, for example, say, a child's parents called in with vomiting, you could click on that link and say, oh, your student needs to be excluded for 48 hours. And I think the last thing that we updated was on the tests positive for COVID-19 and the purple bubbles. We took out notifying the LPHA of the individual case. So you no longer need to do that. You just need to notify the LPHA when you've reached those thresholds. And I think that is all we have, but we're happy to answer any questions.
Hi, Kristen. This is Ronnie. I'm going to read one of the questions that came in. There was a request if you could please date the guidelines documents. There didn't seem to be a date on here, and that way they would know if it would help them to know if it was an outdated document.
Yeah, I can. Sure. This is Miriam. I can confirm that the date is on the guidance document that is posted on our website, on both the exclusion chart and the requirements and recommendations guidelines.
Thank you, Miriam. That's really helpful to know.
Yeah, you bet.
Okay, and then there was a request. Could you send links for where this data draws from?
So I can send links for the graph. So the graph is actually a Tableau dashboard that we post. The other data points were internal data points that I pulled that we don't share. I can share the data that I pulled, but we don't actually share that publicly on any public facing document.
Okay, thank you.
Yeah, and I can put in the chat, I can put the link to the dashboard for the graphs.
That'll be great. Thank you. That was the other question that came in. Okay, that looks like it on our list, unless there's any from Facebook at this time.
I was glancing over at Facebook, but nothing pertinent to this topic. So I think we are good. And thank you so much, Nadine and Kristen, for being here and for sharing this information. We will make sure that everyone has access to the links and to the updated materials. And if any more, oh, I think we just saw another question come through.
So where does the COVID data come from regarding isolation times? Sometimes it's just confusing when it differs.
Yeah, I can start, and then Kristen, feel free to chime in. So the way these guidelines are made, of course, there's continuous research going on as new variants are coming up, and they're kind of tracking the patterns of the variants and how they're causing the illness and infections and what their incubation period is like. All of this information, every time CDC updates their guidelines, the research behind it is cited on the page, on the main page of the update. So if you guys want to take a look at that, you can go to the CDC's main page and take a look at those cited research documents that might help.
Thank you.
All right, let's go on, and we'll transition over to our next topic here, which is ERDC expanded eligibility overview. And we have Elizabeth from ODHS present to deliver this information. And I'm happy to move the slides for you. I'll try to stay on track.
Perfect. And good evening, everybody. Like she said, my name is Elizabeth, and I am a child care policy for the Oregon Department of Human Services. And we just want to cover tonight some of the expansions to the employment-related daycare program, ERDC, that will take effect on January 1st. So the four big changes, the areas that we're changing, are changes to student eligibility, because ERDC will start covering non-working students. We're going to change the way that childcare hours are authorized. We are also going to expand access to authorized medical leave, and we will now allow sleep time for 2 caretaker households when at least one of the caretakers is working an overnight shift. So student eligibility, and this is one of the biggest, non-working students will be eligible for ERDC. And previously, students were not eligible for school hours unless they were also employed. So student hours will be available for all students who are attending classes at any school eligible to receive federal financial aid. They do not have to be working, and the student themselves does not need to receive the financial aid. It's the school that they are attending needs to be eligible for it. We are also expanding student eligibility to high school or GED completion for students who are, or caretakers who are students that are age 20 or younger. So our teen parents and anyone 20 or younger who is trying to finish high school or get their GED completed will be eligible for ERDC coverage while they are in school. And the federal financial aid requirement is waived for that population, as many of them are still in high school. And the last part is an addition of study time for student hours. So anybody who's a part-time student will be given an additional 5 hours a week so that they have time to study, and anybody who is a full-time student will be given an additional 10 hours a week, again, for study time. And then we are going to change some of the ways that we authorize hours on the ERDC billing forms. So we will go to something we call part-time and full-time hours. And at the bottom of the slide, just to make this clear, this does not change the way that you as providers will bill, and it also is not changing the current ERDC payment rates. It will change the hours that you see on most of the billing forms. ERDC billing forms, for the most part, will reflect either 108 hours for a household that qualifies for part-time care or 215 hours for the household that qualifies for full-time care. The extra hours in excess of the 215 will still be calculated based on a family's demonstrated need. The maximum hours that somebody can receive for childcare is $323 a month, and that's not a change from our current policy. The goal of this is to make childcare more accessible to families, and it reflects how providers make their childcare slots available in communities across Oregon with the full-time and part-time. This way you won't end up seeing an ERDC case who only qualifies for 20 hours a month, which makes it hard for them to be placed into a spot. I do want to add a caveat that this change does not affect our families who receive childcare through the TANF program. Those hours will still be authorized based on the family's need, and they won't have the full-time and part-time calculation. Authorized medical leave is a program that we currently have where a caretaker who's already receiving ERDC can take usually around 3 months, it can sometimes be longer, of leave when they themselves are on medical leave from work. But we have expanded it so that the authorized medical leave will be available if the parent or caretaker is on leave to take care of a child in their ERDC Edge. An ERDC Edge for basically means a child who lives within their household. And it will also be available at initial certification. So if the parent or caretaker is on medical leave and needs childcare, they can apply for ERDC. And if they meet all the other income requirements, they could be found eligible at the beginning of a certification. And we are making changes so that we will grant up to 3 months of parental leave when before we only granted maternity leave. So both mothers and fathers would be able to take parental leave with the addition of a newborn to their household. And this last one is about sleep time. Right now, we only can add sleep time to somebody's authorized hours in a single caretaker household. We will be changing that for two caretaker households. So when these caretakers are working an overnight shift, they'll be able to get up to 5 hours per shift added to their authorized childcare hours so that they have the ability to get rest while their children are still being cared for. And then we are working on sending out letters to both providers and families that explain these upcoming changes in more details. And any questions that you have about these, you can always, or anything else related to ERDC, you can always send to us at our childcare.policy@odhsoha.oregon.gov. And then providers who are interested in becoming listed with ODHS can start the process by submitting a completed provider listing form to the direct pay unit. Listing forms and more information, becoming an ODHS approved provider can be found here at this link, which Allison is putting into the chat. And that is all that we had to present, and I am open to take any questions you guys might have.
Thank you, Elizabeth. We'll kind of give a second here if anyone has any questions before we let you jump. I see one question in the Q&A, which just reads, will CCR and Rs also receive this memo?
And by this memo, I think that ELD and ODHS are working on putting together some infographics, which we can share with the CCR&Rs. And if you guys have more questions or you would like to be included in some of this outreach, please feel free to email us so that we can work together to make sure that you guys get the information you need to share.
Elizabeth, can you also update us on where will the updates be posted?
ODHS is updating their website. It has not happened yet. And I cannot answer where they will be posted on the ELD side. It's possible that somebody else may have the answer to that question.
Okay, thank you.
Thank you, Elizabeth. And I don't see anything else on Facebook for now. We know that the information will also be available on the ELD website, and we will share that out. I'm going to make the call here for childcare updates to kind of direct people to the right place once it's there. Yes. Thank you, Elizabeth. Appreciate that.
Thank you.
We will go ahead and we're kind of just plugging along here today. Great. We have a couple of agency and program updates to share with you. And I believe I'll be passing it over to our director, Alyssa Chatterjee, to kind of walk us through some of these and answer questions as well. Thanks, Alyssa.
Thanks, Karina. Good evening, everyone. My name is Alyssa Chatterjee, and I'm the director of the Early Learning Division. So we wanted to start off with an update on the Central Background Registry, which we know has been creating a lot of issues in programs across the state, affecting programs' ability to hire staff and affecting families' ability to find childcare. So we wanted to make sure you have the latest information. So we are now excited to report that our delay for intake, so that time between submitting your application and getting your letter about fingerprinting, is down to about 2.5 weeks. So we are closing in on our original turnaround times of a couple days. Current total average approval time from start to finish is taking about 9 weeks. So some improvement there, but we're continuing to work our way through that backlog. We have done a little bit of research and found that applications for the CBR almost doubled in September. So between August and October, we received a total of 5,500 applications for renewal or enrollment in the CBR. This is partially due to the fact that we hit the first 5-year mark for renewal, and we know the fall is always a peak time for CBR enrollment. So those bodies of work really converged, but we are Working to hire additional staff, we went ahead and trained 35 staff outside of the intake and background team to be able to assist with the intake process. We've also been working to hire additional staff. So a total of 8 staff have been hired for the intake and background teams since October 31st. In total, we will have 18 background specialists and 17 intake and customer service specialists on board by January. We also know and want to acknowledge this is affecting all provider types. So we do not have any sort of prioritization process in place. This is affecting all providers regardless of license type. And we wanted to make sure folks are aware that if you submitted your renewal within 14 days of expiration, you can continue working in the facility. So that is a provision for folks who are currently enrolled in the Central Background Registry and are just renewing their enrollment. I want to acknowledge too that this 9-week timeline assumes no anomalies in your background check. It also assumes you have not lived out of state in the last 5 years. Those turnaround times are varying pretty wildly depending on the state that you came from. So wanted to acknowledge that this is for in-state applicants who don't have anything coming up on their background check. You can go to the next slide. We also wanted to make you aware of a new training. This is called Foundations for Early Learning. It's available to all early care and education providers, and it is free, 2-hour training on child development, available on the Learning with OCCD website, which you can see a link for here. And it's available in English, Spanish, Russian, Vietnamese, and traditional Chinese. And the deadline to complete this course would be December 31st. So you have a little bit of time to squeeze that in by the end of the year. And you can go to the website listed here for more information about this training. And as a reminder, this is a required training. So if you've not completed it, you still have several weeks left. And again, it is free. And if you're having any issues locating this information, please let us know. Next slide. We also wanted to make sure you were aware of a survey that's going around. So every 2 years, we're required to conduct what's called a market price survey. This helps us collect information and the prices of childcare to help us understand what the current cost is, as well as the childcare supply across the state. So this will inform regional and state policymaking so that we can ensure families have access to childcare across the state. This data is also going to influence the Oregon Department of Human Services maximum subsidy rates for employment-related daycare and is the basis for the Child Care Desert report that's issued and Child Care Desert tracking over time. So this survey is going to be conducted through the end of the year. So you should be contacted through your child care resource and referral to verify the rates you charge and any additional information, including your current child care capacity. We do not share this information with parents. It is aggregated with other facilities, so there is no identifying information that comes out of this, but it's really, really critical as we prepare to negotiate rates for the next bargaining cycle if you are a union represented provider. And it's really important as we work to enter the legislative session and make sure that the legislature is aware of what childcare is currently costing families. And then again, this will be really critical for the Child Care Desert report that comes out. And this has been getting a lot more attention, and a lot of legislators and policymakers have really been referring to these reports to understand what the childcare capacity in their communities is. So please watch for more information from your local childcare resource and referral. And we really appreciate you participating in this survey. Next slide, please. We also wanted to make you aware that we are revising the Oregon Administrative Rules, or OARs, for certified childcare centers. So we will be hosting a community rule revision work group, and this is really going to support the development of the draft rule language on a variety of topics that have been lifted up through various OCC listening sessions. So we really want to have a diverse group of individuals who have interacted with programs across the state. So this could include directors or representatives from certified centers, community partners who are working with young children in these childcare settings, or parents or family members of children in these types of programs. Applications for the work group are going to be available in early December, and our hope is to start this work group in January 2023. This is separate from the Rulemaking Advisory Committee, so it's really intended to help us do the pre-work that the Rulemaking Advisory Committee will help us with later on as we prepare to actually pass the rules. So there will be multiple opportunities to participate in rulemaking, and we're really excited to get this work group kicked off next year. Next slide. Here is more information. We are hosting a virtual event on the 29th and 30th on the certified school age childcare centers. So as a reminder, rules passed by the Early Learning Council for school age center rules. This is the first school age rule set we have passed. So we are making this information available to you. So you'll also see that coming in January, we will have a webinar video series on these school age rules. As a reminder, these rule sets were passed in June and take effect in January, and we're working to make sure there are a lot of supports available to school-aged certified center programs. And you'll be able to hear from the regional manager in the Office of Child Care, as well as one of our senior licensing specialists, and have an opportunity to go through questions and make sure you understand the rules and are really set up to be successful and supported heading into the new year. I think that's it. I'll hand it back to you, Karina.
Thank you so much, Alyssa, for all that information. Just like we mentioned, lots of great updates. And this is an awesome reminder to subscribe for the childcare updates if you have not yet done so. This is where we'll be sharing information as it comes out as well. There are a few questions. Actually, I saw a question on Facebook earlier asking about the startup grants and if there was any information on that. I believe we don't have any information on that yet. And again, once we do, we will go ahead and share that in the childcare updates if it's before our January meeting. And hopefully we will have something to share then, but nothing to report at this time. We just haven't received anything for that either. And then dates for the January webinar, I'll have to pull it up in a second here. We'll go ahead and share that right away. Anything else that we see, Ronnie, anything that we captured for questions?
Sure, there was.
Oh, sorry, go ahead, Ronnie.
I was thinking there was just a comment in around the CBR that this delay in the CBR is crippling programs' ability to onboard staff and therefore serve families. An employee can't wait 9 weeks for a paycheck, and programs are being forced to close classrooms or groups when several staff call in sick.
Thank you, Ronnie. Absolutely, absolutely agree. And we're working, Karina, we can see your email. We're working to get staff hired as quickly as possible to get through that backlog. Our staff have to go through the same CBR process as well. So that is impacting our ability to hire, but we are working to get additional capacity as quickly as possible. Our hope is that as we get through this backlog, we'll now have enough staff to prevent a future backlog. We are anticipating another spike in renewals in the spring, just knowing that the summer tends to be another hiring period. And our goal is to make sure that we have the right structures in place and enough staff on board so that we don't see backlogs grow to this level in the future. And I just want to apologize and acknowledge the ability for you all to run your businesses and the effect this is having on the families you're serving as well.
And if we could just also highlight all the links that are in the chat box, there's a lot of goodies in there. So make sure that you copy those links on at least to a document until you have an opportunity to look at them all later.
Thank you.
Karina, I can add, there was a question about the dates of the school age rules sessions, and those are November 29th or November 30th. There's two different time options at the end of the month, and the link is in the chat as well.
Thank you. And just as a reminder, the slides will be available on our website as early as tomorrow. We have to get our comms team to upload those, but you'll be able to download these and to access all the links on there as well, and share them with others if that seems helpful to you as well. It looks like we have covered everything that we had for today. We look forward to having you all once again back in January. May you have a wonderful end of the year. It feels so odd to say that because we're in November, but it's just kind of that time of year where we are. So just really appreciate all of your participation, your engagement, your questions. We look forward to continuing this relationship with you in January. Thank you so much, everyone.